Royce Regional Health Network welcomes you to the Equity Circle podcast.
The end of the public health emergency for COVID-19. The Biden administration announced it plans to end the COVID-19 national emergency declarations on May 11, 2023. Before the declarations expire, the administration and other national, state, and local leaders will share detailed information about what the policy change will mean for organizations, healthcare providers, individuals, and families. In the meantime, here is some basic information about the announcement. What is an emergency declaration? Under U.S. law, the President can declare a state of emergency during a crisis. While the state of emergency is in effect, the executive branch has emergency powers to address the crisis. When the state of emergency ends, the powers are lifted and policies that the President had enacted using emergency powers will expire. What emergency declarations were issued related to COVID-19? The Trump administration first declared a public health emergency, PHE, on January 21, 2020, and declared a national emergency on March 13, 2020. A public health emergency lasts 90 days, so it has been renewed multiple times. Governors in all 50 states have also issued state emergency declarations related to COVID-19, which are separate from the national emergency and public health emergency. In Washington state, Governor Inslee ended the COVID-19 state of emergency on October 31, 2022. What COVID-19 policies will be affected? Under the COVID-19 Public Health Emergency Declaration, the government has more flexibility in a number of health-related areas, including fully covering the costs of most COVID-19 testing, treatment, and vaccines. When the emergency declaration ends, coverage for COVID-19 will become more like coverage for other medical conditions. In the coming weeks, more information will become available about specific changes, some of which might vary by health insurance. You can also review the Kaiser Family Foundation's summary of policies and provisions related to the COVID-19 national emergencies. There will be changes in eligibility for health care like Medicaid, Medicare, and CHIP, coverage and benefits from public and private insurance plans, access to telehealth, and the production of COVID-19 materials. Be sure to discuss with an insurance representative or healthcare navigator for details. Does this mean COVID-19 is over? Ending the COVID-19 emergency declarations does not mean the virus has been eradicated. States of emergencies are intended to be temporary, and when emergency power expires, that does not mean that all the policies related to COVID-19 end. Continue to consult CDC's website for guidance, as well as guidance from Washington State Department of Health and local health departments. CDC continues to advise that everyone get vaccinated, get the latest booster, use at-home tests if you've been exposed or have symptoms, stay home if you're sick, and wear a high-quality mask when COVID-19 levels are high. These precautions are the best ways we can continue to protect ourselves and manage the pandemic as it continues to evolve. While we don't know the future of COVID-19, many believe that the virus will fall into seasonal patterns, possibly like the flu. It will likely take years to fall into such a pattern. For now, we will likely see waves of cases rising and falling as the virus continues to change. What you can do. There are a few things you can do to prepare for the end of the public health emergency. First, be sure to update your information with your health insurer to maintain eligibility or check if you may need to gain new health insurance. Second, before May, if you are eligible, stock up on free at-home test kits. You can order kits at covid.gov. Third, get your COVID-19 vaccines, including the bivalent booster. Find a vaccine clinic near you by using the Vaccinate Washington website and vaccine locator tool. Thank you for listening to today's community update on the end of the public health emergency for COVID.
The content shared in this episode is for informational purposes only and does not constitute medical advice. Please consult with your healthcare provider about any medical concerns you may have. Reference to any specific product or entity does not constitute an endorsement or recommendation by Choice Regional Health Network. The views and opinions expressed by guests and Choice employees are their own and do not necessarily reflect the official views of the Choice organization. Choice Regional Health Network follows all guidelines set up by the Center for Disease Control and Prevention and the World Health Organization.